Welcome to NARAL's The Morning After. Each week, our podcast brings you the latest on reproductive health care, progressive politics, and the fight to keep abortion safe and legal. You can listen to the show on Apple Podcasts, Spotify, Stitcher, Podbean, YouTube, and on our website at prochoiceohio.org. The program also airs each Friday morning at 9 on WGRN 94.1 in Columbus, Ohio. Follow us on Facebook, Twitter, and Instagram at ProChoiceOH. NARAL's The Morning After is a production of NARAL Pro-Choice Ohio. Enjoy the show! Hi, I'm Kelley.
Hi, I'm Ariana.
And I'm Rhyannon.
So we're doing something a little different this week for the podcast. It's not like any legislative session stuff. It's not any of our typical topics, I don't think. We're talking about the history of abortion, kind of going not quite a deep dive necessarily, because we do only have half an hour, but like we're going past 2011 into the past of abortion access.
The old days.
Yeah, the old days of not this decade or not this century even. Oh man, it's weird to me that like the 1990s is a long time ago for abortion access, and we're gonna go back to, I don't know, how far back are we going, Rhiannon?
I think that it'd be really reasonable to start in the 1920s, exactly 101 years ago.
Oh yeah?
2021 if you forgot.
Oh no. So what is going on in 1920 in, let's say, the United States regarding abortion?
Well, of course, we know that there's a big depression, and we have a lot of immigrants coming into New York specifically, and that gave rise to more access to education, because New York had a lot of free schools for a while that were allowing immigrants to go to night school and learn English and then get degrees, not just trades, which is partially nifty. However, then it gave rise to the medical community being male-led, because women were still staying at home and taking care of the homes, even in a new country. So it was the rise of the medical community wanting to discredit midwives and previous medical systems that had put in place of taking care of the people, because that's what you do when you're a community. So they wanted to take a stand and, in one hand, discredit women, and in another hand, force people to get degrees and pay to go to college to get medical degrees. But they weren't teaching very much about safe abortions and how to perform abortions at medical schools in the United States at all. So these doctors didn't know how to perform safe abortions. So they just thought abortions were unsafe and were damaging.
So was abortion legal in the 1920s in the United States?
It was right before, I believe it was legal until like 1923 or 4, when this medical association came up, took a stand, and they decided to ban it and make it illegal until 1972 or 3.
1973. 1920 is also the founding of Planned Parenthood, and just off the heels of, the last global pandemic, the Spanish flu, as well as World War I. So you're seeing an interesting rise in globalization and international movement that we hadn't necessarily seen in the same capacity before. And also, albeit illegal, the rise of birth control. So an interesting time. But the history of abortion in this country, and I mean, I guess the world, it's people have definitely wanted to not be pregnant for as long as humans have existed. As I understand it, there's a plant from the African continent that is extinct because of how much it was used for terminating pregnancies.
And 2 of the earliest medical books, one came out of China and one came out of Egypt, both had passages and instructions on how to perform abortions and what was good for abortions.
There's a lot of historical knowledge that is lost on how to perform abortions because it was largely in the hands of midwives, which were criminalized by the American medical establishment.
Like, taking it across the border for a second, I know I studied this a million years ago in college. Like abortion was just a couple years ago.
I was like, ma'am.
Actually, 4 years ago in college, I studied about like abortion in Mexico, and like, you know, a couple hundred years ago. And yeah, it was just something that like happened. Like it was kind of like a little hush hush after like Spanish colonizers came with like the introduction of Catholicism, but it still happened. You would just go to like, you know, a midwife-esque woman and be like, hey, get this out of me. And she would, you know, and people were fine. And, you know, that maybe not as safe as the options we have now, but it definitely wasn't super unsafe. It wasn't this, you know, weird secretive thing the way it became, as Rhyannon was saying, with like the, you know, medicalization of reproductive health care.
And it actually wasn't until the late 19th century that the Catholic Church disallowed abortions until very, like, historically, until very recently, they didn't have a strong stand against abortion. So I think that's really interesting that a lot of times we talk about the Catholic Church as in they've always been against abortions, and they haven't always been against abortions or birth control.
Yeah.
What was the political context in which they decided to have a strong stance?
You know, I'm not sure. That's definitely something that I will have to look up.
And even, I mean, prior to 1973, abortion was seen as like a Catholic issue. It was not Christianity in general. It was not an evangelical issue. It was really just a Catholic issue. And it's really not until probably the late 70s, early 80s where you see it become a wider moral majority kind of movement. And I say moral majority in the biggest of air quotes because they are neither moral nor the majority.
They're just loud.
Yeah.
Take up a lot of space in terms of volume, but not in terms of actual percentages of people. But yeah, I think it's interesting that, you know, this didn't happen in a vacuum. Like, it's not like one day suddenly people were like, wait, that's what we've been doing for centuries. Like, I'm against that. It was, you know, part of a concerted effort by people in power to, you know, stigmatize and, you know, attempt to criminalize abortion, because before it was just, yeah, it just happened. Women just did it. You know, we might not have like been marching down the streets talking about how much we love abortion, but we've always, because again, like, it wasn't like super medicalized. It was just,
menstrual regulation.
Right. Yeah. Right. Yeah. Because like childbirth wasn't medicalized either, or like periods. Like, we just let our uteruses kind of do their thing without doctors getting involved with them, you know, for a very long time. And when they did first try getting involved with them, they thought that our wombs wandered throughout their body. So obviously they did not start off on the right foot.
Oh my gosh, when trains were invented, women weren't originally allowed to travel on trains because they thought the uterus would fly out of the body.
Yeah, I mean, extra little seatbelt.
We have a word that is, you know, the etymology of it is related to uterus and it being what? Hysterical. Like there's, I mean, medical misogyny is nothing new. It's just getting more and more precise in a lot of ways.
Yeah, vibrators were invented to cure hysteria because people didn't know that you could just have an orgasm and like it. It was like you would go to the doctor for them to use this piece of medical equipment to like cure your hysteria.
Because the doctor's wrists were getting tired.
Yeah.
Yeah. They were manually performing orgasms.
Yeah.
I really love to think about doctors prescribing orgasms to cure hysteria. And I don't think they called it frigidness, but they did a few years later. And then doctors being like, wow, this is a lot of work. Let me invent a machine to do this. And if you look up a picture of it, it's intense.
Yeah. I will say in a roundabout way, they're not wrong. Masturbating and orgasms is very good for your mental health.
Right. And for stress relieving and stuff. But what's funny about all that is they didn't see it as like sexual release because women they didn't think like we got horny yet. You know, like that also kind of relates to how like sexuality was viewed back then too, like in 19th century era. Like women very often had like extremely close female friends that they would spend a lot of time with and send flowers to and have sleepovers, and nobody really, like, it was obviously like not fully a thing, but like men just didn't think that women could have sex without a man. So it wasn't like there wasn't as much homophobia towards like what we would call now like a lesbian couple as there were to like gay couples. I mean,
Your
like,
Boston roommates, I think is what they was like one of the nicknames, Boston roommate.
right, yeah.
Yeah, as long as they got married in a reasonable time, and I say that in air quotes, then society was like, okay, cool, live with your best friend, live with your cousin, call them whatever you want.
I mean, queer people and abortion has always existed. Die mad about it.
But
What happens between the 20s and 73 as far as abortion is concerned? I mean, we have the feminine mystique from Betty Friedan. We have second wave feminism because the first wave is, women's suffrage in 1920 with the 19th Amendment. So what happens between those times?
Yeah, so we really didn't have a lot of activism around abortion that between then. It feels like history kind of goes silent on it, and I think part of that is because of World War II taking up a lot of space rightfully. But there's just not a lot of information on what happened between then until the civil rights movement started, the queer movement started, and women's rights started. So it feels weird that it just went silent, but I guess people were preoccupied in other ways. However, we do know that abortions didn't stop, because when the abortion debate really blew up, there was doctors that were performing them not undercover, but like behind closed doors illegally. They were turned to talk about how they did it, because schools still weren't teaching how to perform abortions. So doctors were figuring it out, or non-licensed people were doing it in unsanitary places. And we have recorded deaths. They had a saying of like the Monday day lineup, where women would get paid on Friday, get an abortion on Saturday, and be lined up at a clinic or a hospital on Monday to get cleaned out from whatever was used to try to induce an abortion.
oh, I hadn't heard about that before. That's really interesting.
I mean, we honestly still see that today, where you will see an increase in abortions performed in January or in August and October, or September and October, because it's after their children go to school or after the holidays for presents, like, where people will have to like save their money back up after a holiday. So it's a big influx in the new year. So it really hasn't changed that much since ever. I think what's really just kind of changed is people's understanding on whether or not it's legal in Ohio and other places. So we've gotten to, let's say, 73, where we have Roe versus Wade, the decision that makes abortion legal, and allows states to kind of define what that means without outlawing it outright. 76, we see the first iteration of the Hyde Amendment, which outlaws federal funding for abortion. And then we also start seeing our first deaths because of the Hyde Amendment. So patients who are unable to access abortion care, who then take it into their own hands and don't have the best outcomes.
What I found was interesting when I was researching was that America was the first country to open clinics to perform abortions, opposed to performing them within hospitals, where that's normally where they're performed in Europe still today. And then, of course, it's easier to target a clinic that is doing XYZ, opposed to an entire hospital where you may feel differently about other things that are going on in the hospital. So there was a partial positivity because it allowed for there to be direct funding to funnel towards the clinics, but then all of the hatred and anger can get really easily targeted towards them.
I mean, and then you see the rise of trap laws, like targeted regulation of abortion providers can't necessarily happen in a hospital setting because the hospital is the hospital, but you can kind of put those rules on a freestanding clinic because they're going to have a harder time complying with them.
And I think also like having abortions only being performed like in a clinic, I feel like it adds like a layer of like caution, I would say, around the procedure, because I think it makes people feel like it's a lot harder of a procedure or a more complex procedure, and that's why it needs to have a standalone clinic. Like I know, like I've always been pro-choice. I remember being younger and thinking like, wow, if they have to have like their own clinics, like this has to be like some really hard thing that only like highly specialized gynecologists can do, when that's really not the case at all. It's super simple, quick and easy. So there's really
Right. It's an outpatient facility like so many other things like colonoscopies or your dentist's office. But I do think that standalone clinics do kind of add a layer of stigma because if it's an abortion clinic, you know what those people in the parking lot are there to do. So there's kind of a layer of privacy taken away when it's a standalone clinic that you wouldn't necessarily have to deal with in a hospital setting. Not to say that abortion has to be medicalized. There are people who take abortion into their own hands with self-managed abortion due to personal reasons, whether it's they don't want to have it happen in a clinic setting or, religious reasons or spiritual reasons. So there's no obligation for it to be medicalized, but I feel like it's also taking away, that option of privacy in a hospitalized setting that you wouldn't have to worry about because you're just there like everybody else is there for the hospital.
Yeah, definitely. Yeah, and I think like, there's definitely been like a rise in awareness around self-managed abortion over the past, definitely the past couple years. I would say like the past like 2 or 3, it's like, like skyrocketed in terms of visibility. But I think it's great because yeah, like abortion has always been in our own hands, for hundreds and hundreds of years. And then, became medicalized, but that doesn't mean it has to stay medicalized. You're taking medicine and it's, something to do with your body. But again, like just the way that we don't have to give birth in a hospital, you can have a home birth and be with a doula or a midwife. I think abortion should be seen as and treated the same way, because with more information and more, medical research, that makes those things even safer. Because, if you want to have a self-managed abortion, rather than like guessing at like what types of like herbal remedies to use or things like that, what to use for it, and then you can just do it.
Right. So we've made it to the 80s in our abortion journey. And like I don't know anything about abortion in the 80s. Like to me it's just kind of a black hole. Like we won the right and now everything's fine. Were there abortion laws passed in the 80s? I assume there had to be.
Well, I know that in France in 1988 specifically, mifepristone was approved, although it wasn't approved until 2000 in America, which feels sketchy. Why are the French on top of it and we're not? But there was really just some back and forth. They did determine they did a study of abortions between 1979 and 1986, and that is where we get the statistic that abortions are 10 times safer than birth, and which continues to today because we continue to assess that statistic to make sure it's accurate. In 1968, going back a little bit, is when the vacuum aspirator was licensed, but between that we had a lot of terrorist attacks on abortion clinics in the 80s because the clinics were newer, so it was easier to target them. The idea sprouted pretty early as soon as the clinic sprouted up.
Yeah, that's right. It was under Bill Clinton that the FACE Act is passed. I don't know what FACE stands for off the top of my head, but it has to do with blocking clinic entrances and that being a federal offense. So Sorry.
That was also when they decided not to have the 15 feet radius around individuals and cars, but just the clinic.
The FACE Act stands for Freedom of Access to Clinic Entrances. And yeah, it was signed in 1994.
As far as the French go, they've always been ahead of the United States. They may have taken a page out of our book as far as their own revolution goes, but I will say that, with Simone de Beauvoir and egalitarianism as like part of their constitution, like whatever their freedom, liberty, egalitarianism is just equality. It's part of the French, I don't know, concept of existence. So I'm not really surprised that they're ahead of us as far as mifepristone is concerned.
They've definitely kept the revolutionary spirit alive a lot better.
Right, no.
In America.
Absolutely.
Yeah. But yeah, I mean, mifepristone and misoprostol are the two pills we use for medication abortion. And yeah, like lots of other countries like already knew about this and like were using them. I know mifepristone, or was it misoprostol? Misoprostol was like found out to be used, can be used for abortions by women in Brazil, like I want to say like early 20th century, or like mid 20th century. But
so misoprostol was also under the name Cytotec, and it is used for stomach ulcers. And yeah, it was pretty quickly found out to also induce, labor.
Right, yeah. And then since misoprostol is used for so many other things, in some countries you can just get it over the counter. Like dogs get prescribed misoprostol for some reason. And so it's, that makes it especially strange that in America it took so long for it to get FDA approved, because it was already known to be a very, very safe drug. It's actually safer to take than Tylenol is. And I could go to CVS right now and buy as much Tylenol as I wanted, and yet I can't do the same misoprostol as I could with that, which seems a little goofy.
Yeah, the medication abortion regimen is also really interesting because there was a different regimen up until 2016 that was FDA approved. So there was the FDA method that had a higher dose of misoprostol and was not as effective. It did not go as late in pregnancy as what was called evidence-based method, which was less misoprostol and could go up to 10 weeks of pregnancy. So due to an Ohio law, until 2016, we were not allowed to use the evidence-based method that was more effective, less expensive, and less dangerous. And it changed overnight when I was working at the clinic in 2016. And it was incredible. Like, it was maybe one or two people had opted to take the medication abortion regimen when I was working at the clinic. And then it overnight, immediately, was about half and half. So miso is an interesting drug.
Yes.
So we've made it to the 80s and the early 90s. What happens from the 90s to present day, Rhiannon?
Well, something that was really big is that in 1994, the same year as the FACE Act, the Medical Students for Choice organization started, where it's a club on, as far as I know, every medical campus, where they advocate for teaching abortion in medical school. So that was really, really big because it still was not being taught regularly and consistently. So they create a presence because they create a presence on campus to continue exposing med students to abortion and abortion access. And even though statistically not all of them go on to become abortion providers, more medical people are trained to give abortions than you would really think, because these clubs really did enact rules to teach abortion.
Yeah, like it's, shows how little capitalism and, hetero patriarchy cares about people with uteruses, because they took abortion away from us in a way and medicalized it so heavily, and then it got to a point where they don't even teach it in medical school, like you were just saying, people themselves had to advocate for it to be taught more widely, and it still isn't. If you would like to become an abortion provider, you need to specifically look for medical schools with that in mind, because it varies by it's been over 20 years since Med Students for Choice began having a presence on campuses, and to this day you still aren't guaranteed to have that education at every medical school.
Not only in the campuses where it is offered and is an option, it's opt-in. It's an opt-in curriculum. So there are OB-GYNs out there who have never undergone abortion training. They've gone under medical or miscarriage management, which is, the same procedure, but your abortion provider is going to be infinitely more skilled at it because they do it a lot.
Yep. And again, it's not like it's some extra higher level thing. Like, it is super, super simple to have an abortion. Like a medication abortion, you just swallow pills. And like for an aspiration abortion, you just, multiple steps, but basically, dilate the cervix, aspirate the contents of your uterus, dispose, eat a snack, take a nap. Very simple.
The Jin Collective showed us that anybody can do abortions.
Right.
There is a fellowship in family planning that will sponsor students who plan to become abortion providers to pay for their med school.
Is it based out of Arizona? I think I've heard of this.
I think it's California.
That makes sense.
Another interesting thing about, despite abortion being a relatively easy procedure to learn how to do and perform, is who's legally allowed to do it. Because in the state of Ohio, it is only licensed physicians, not nurses, not nurse practitioners. They can't even dispense the medication, if I understand correctly. But in California, nurses, physicians can do it.
Yep. Again, that makes it seem like it's this scary thing that you have to undergo when, nurse practitioners should be allowed to do it. And I think LPNs should be allowed to do it. It's not that many more steps than a pap smear is.
Right. And
even pap smears, I get mine from my primary physician. I don't even go to an OB/GYN for them, because again, it's pretty easy to do some fiddling around down there. Again, Jin Collective shows that it's not that hard. The Jin Collective was a group of women in Chicago, pre-Roe v. Wade, who took it into their own hands to provide abortions, because this was that kind of black hole of abortion being stigmatized, criminalized, medicalized, but it still happened. And so the Jin Collective made sure that if you needed an abortion, you could safely and privately get one. And since so few doctors were trained on it, they just decided, what, we're going to teach ourselves how to do this.
So what happens after the FACE Act in the 90s and the approval of misoprostol and mifepristone as the medication abortion regimen?
Then we just get to see Roe v. Wade be challenged in a multitude of ways. But in the early 2000s, around 2005, anti-abortionists realized that they weren't getting anywhere trying to protect fetuses, so they decided to try to go after the health of the pregnant person, which led to the idea of a post-abortion syndrome, which then in 2008, it was officially debunked. by long-term studies. However, there's still a lot of debate about those studies because you can't have a like double-blind experiment where half of people get abortions and half of people don't get abortions.
Yeah, that would be unethical. The early 2000s is also when we see the DNX ban, right?
I'm not sure.
Yeah.
2003. Yep.
Great.
In the misnamed Partial Birth Abortion Ban Act. An early, I say early, a perfect example of antis using language to misconvey what a procedure actually is.
Yep.
So, we also, so there was Planned Parenthood versus Casey in the 90s as well, right?
That was a little late. That's like 98, right?
I don't remember. I am not a scholar of law.
1992.
No.
Everything in the 90s happened at once.
Pretty much.
Yeah. But
so Planned Parenthood versus Casey upheld the constitutional right to have an abortion as established in Roe v. Wade, but it altered the standard for analyzing restrictions on that right, which is where we see the undue burden argument established, although not really used until 2015 with Whole Women's Health decision.
Right, because even though Roe made abortion legal, legality doesn't mean access, and so conservative lawmakers decided to try to limit it as much as possible, and so Casey really helped with not having like certain bans like go into effect because they would cause undue burden, and like Kelley just said, that had to be reaffirmed with Whole Women's Health, and then with wasn't there another case in the past couple, the Little Sisters versus something, wasn't that also tied up with Whole Women's Health?
Little Sisters of the Poor versus Pennsylvania.
What was that? Yeah, PA.
And that was decided, last year.
Feels like it was 3 years ago.
Right.
But yeah, because again, legality doesn't mean accessibility, and even though we have that president sat with Casey to avoid undue burden, that doesn't mean that there still isn't undue burden of on people who are trying to access abortion. Like I would argue that it's undue burden to need to go into the clinic twice to get an abortion. It's an undue burden to have to drive hundreds of miles to get to the clinic, and all these other restrictions and stipulations that we have around accessing abortion care.
Right. So your 2000s and is really when you start to see abortion bans pick up. So there's the partial birth abortion ban in 2003. But there's other legislation that starts picking up at the state later on in that 2000s. And then we get to, this last decade of 2010 to 2020, which has been, hellfire. Just one ban after another.
Yeah.
Anything else I'm missing in the first 10 years of the decade? I don't know.
That sounds very encompassing of what I found.
So, and just for an example, in the 6-week abortion ban has been introduced in the Ohio legislature damn near every session since the early 2000s, but really actually starts to pick up steam in 2016, where it passes for the House and Senate, but the governor vetoes it. 2018, where it passes, and the governor vetoes it, but the House overrode it in 2018, but the Senate didn't, which was weird. And then it was finally passed in 2019. So And Ohio was not the first one to pass this bill. Arkansas passed it in 2013, as well as Wyoming and North Dakota. And there's been a slew of other states that have introduced such legislation and passed it since we have.
Yep. Yeah, a lot of these anti-abortion bills, these abortion bans, yeah, like similar ones get proposed and voted on in different states. Like they just share stuff to see what will stick, basically, and see how they can get it to a higher court, with the end goal of overturning Roe.
Gabe has used a metaphor on previous editions of this podcast where he says you can either take the stairs or the elevator. It doesn't really matter. The goal is still the same. So
yeah,
like you can pretend that one piece of anti-choice legislation is more reasonable than the other, but the end goal is still the same. It's to outlaw abortion. Which, is there anything else I'm missing between 2000 and now?
Well,
I mean, there's 23 restrictions that have passed in Ohio.
I mean, we've lost half of our abortion clinics. So that shows, the onslaught that we've had over the past 10 years. I think due to like advances in other areas and like more awareness about other social justice issues, I think especially for younger people, they don't see like the dire state that abortion is in. But it is in a very, very dire state, more so than it might have even been like in the earlier 2000s, because again, we lost half of our clinics in the past 10 years. And so now there's,
I think for most people, it's not really an issue that they necessarily think about until it's something that they need to access.
Yeah.
And that's an unfortunate time to realize that there is not a clinic until there's within 2 hours of you.
Right.
Which, can also bring us to, the open study that came out, yesterday, I think?
I don't know. I don't know what days are. It came out this week. But yeah, so again, like, abortion isn't talked about that much. It's, people, like Kelley just said, people don't think about it until they need it. I think a lot of that does come from stigma again, there's so many people who are like, oh, I'm pro-choice, but and blah, 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 and things like that. So that's why it's so important to like be unapologetic about your support for abortion. But yeah, there's so many bills all the time that are bad. We're losing all these clinics all the time. And so like it kind of has led to people being confused all the time about abortion and if it's legal or not. And it has been legal since Roe v. Wade. But it doesn't always feel that way.
I think an important thing to realize is that while so many of these patients think and believe that abortion is illegal, they are still going out of their way to try and access it. So it doesn't matter whether or not it's legal or illegal. If they are able to access it, they're going to do their damnedest to do so. So it's just a matter of whether or not we criminalize the people who are seeking care. And as far as the open study, this is the Ohio Policy Evaluation Network. They found that 1 in 10 Ohio women thought abortion was illegal amid attempts to ban abortion at 6 weeks. So it didn't matter that the bill had passed or was signed by the governor or was vetoed by the governor or the veto override failed in the Senate. It didn't matter. The fact that it was so much of an issue that the Ohio legislature focused on for 4, 5, 6 years made people, at least like 10%, think that abortion was illegal. And the percentage with that belief increased from 5% to 16% during the study period, corresponding to sustained activity to limit abortions from the fall of 2018 through the summer of 2019. And if you want to see this full study, it appears in the American Journal of Obstetrics and Gynecology. There we go. Words are hard.
I mean, I remember, I don't know if I would have guessed that it was 10% of people, but I remember, when the 6-week ban was passed, and voted on and stuff, I remember feeling like I was walking around with like a fire extinguisher on social media, being like putting out these fires, and people being like, oh my gosh, like I will drive you to a different state to get an abortion and blah 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 and all this stuff, because people thought that it was outlawed like then and there. And so I was spending like a lot of time being like, no, it's still legal, it's still legal, it's still legal, because there was just so much like fear that it was illegal. No, I didn't see anybody who was happy about that. They were scared because abortion is super common, and if you haven't had one yourself, you know somebody who has, or you will know somebody who has. And so it's a lot of fear mongering is like a big part of these bills as well, to make people think that they can't access healthcare.
Yeah, it sucks.
Yeah, it's bad.
But abortion is legal in Ohio, and you can go to our website, our partner website, abortionisstilllegalinohio.com, to find out where all of our clinics are, and about how to navigate how to get an abortion in Ohio.